Today we are joined by Elizabeth Perry, Olivia Djouadi, and Dr. Erin Falconer. Elizabeth Perry is associated with the New Age spirituality community from 1985 to 2001 in Canada. Since 2015, she has become a registered professional counselor and supports clients around the world using culturally relevant, trauma-informed care via video to recover from their pasts and reclaim their futures. Dr. Erin Falconer provides psychotherapy for survivors of trauma and coercive control. She has over a decade of research experience, including studying post-traumatic stress disorder, the subconscious processing of fear, dissociation, hypnotic response, and a placebo effect. Olivia Djouadi is an accredited UKCP psychotherapist in London, England, who works with severe trauma and chronic illness support. She teaches online counseling and supervision to trained counselors and psychotherapists. Thank you, Elizabeth, Olivia, and Erin, and welcome.
Hi, my name's Elizabeth Perry, and I'm participating in a panel presentation today on the topic of experience with accessing mental health support during recovery and becoming a mental health provider as a survivor. What I'm going to be covering off on today is a quick review of my cult experience, factors that were at play when I was leaving the cult, factors at play when I was seeking mental health support, and a psychiatrist's therapeutic focus, what worked and didn't work, a psychologist's therapeutic focus, what worked for me and what didn't work, and then becoming a mental health practitioner myself. So I'm going to give you a quick overview of my cult experience. In 1985, it was a really cataclysmic year for me, with many intense experiences that changed how I viewed myself, others, and my purpose in life. As a result, I was vulnerable, and when a friend invited me to attend a Sunday service with a local spiritual group, I accepted with great hopefulness. During the service, I experienced what I interpreted at the time as direct communication from God, similar to rapture. It was only years later that I realized I had been hypnotized, but as a result of my perception of that experience, I suspended my critical thinking and submitted to the increasingly all-encompassing experience with the group. 3 years later, when I had the opportunity to get out, both my family and I were coerced into having me stay. It took me another 13 years to finally leave. What finally enabled me to leave was a definitive sense of disillusionment, when I was clearly able to see the contrast between the talk and the walk of the leader. I took 4 years to accumulate the data I needed to convince me that I wasn't leaving God, but that the people I was with were not actually in alignment with what I considered God to be at the time. At one point, I finally shared my experiences with a sister who was visiting from across the country, and she validated my interpretations of what had been happening. She helped me leave a short time later and made sure I was set up in a safe shelter before returning to her own home on the other side of the country. I'm not providing all the details of my cult experience and exit because that's not the topic of this session, but I provide the information to give a bit of context for the recovery process I undertook after leaving. If you're interested in more details of those aspects of my experience, you can find other presentations I have given for ICSA in their archives. So what inspired me most to seek mental health support once my sister had left and I was on my own was the overwhelming sense of destabilization. Understandably, I was numb, questioned my ability to trust myself and other people. I continued to work, but I was like a walking zombie. I felt like I'd been hit by a dump truck and was stunned. Just going through the motions and still trying to reestablish stability in other areas of my life. I hadn't crashed yet, but I fully expected to, under the weight of the realization that I'd wasted 16 years of my life on lies. Anticipating the yet to manifest effects of my realization, I wanted to put in place a safety net for myself for when that crash happened. In 2001, the mental health system in Nova Scotia wasn't very well established for street access. The only option I had was to seek help at the emergency department of the local hospital. To put in place the safety net for myself when I did collapse, which I expected to do after realizing the cult nature of my experience, I reported to the intake nurse my goal in reaching out to her. I can't say what she thought, but I was made to wait for 8 hours, near the end of which I was placed in an empty room similar to a prison cell, isolated from the rest of the patients. I suspected there was a two-way mirror in the room through which I was being observed. I remember being conscious of my surroundings and trying to behave normally, but I was so tired and had had nothing to eat or drink the entire time that I laid down on the wooden bench and just lay there tossing and turning, agitated with the long delay. After speaking briefly with an intake psychiatrist, he sent me home with medication to sleep. Within 7 days, I met with a panel of 3 assessors who came across as cold, clinical, wielding their power over me with their interpretations and false characterizations of me. To my surprise, they labeled me as speaking psychobabble because they did not recognize my speech pattern as cult speak and loaded language. I felt misdiagnosed, unheard, unsupported, thrown into a category that completely ignored the circumstances I had come to them as a result of. 30 days later, when I was contacted by a psychiatrist to whom I was assigned, I was resistant to meet with her because of my experience with the system thus far. She convinced me to give her a try with one appointment. After giving her a quick overview of the lows of my life, she simply said, "Lady, you got to grieve." With this, I felt I would at least get some help, so I agreed to meet with her twice weekly while she helped me stabilize. Knowing she was available to me was key to my ability to regain some traction in my identity, agency, relationships, and function. Unfortunately, she knew nothing about cults and the effects on people's mental health. She officially diagnosed me with adjustment disorder, which to me was an offensive minimization of the effect of my experience on my mental state. 4 months into working with her, I came across the book Exit Counseling by Carol Giambalvo. It felt like Carol was writing about my life. It was the first time that I really understood for myself what I had experienced, rather than just associating my experience with the general label cult, without remotely understanding what that actually meant. After coming across Carol's book, I reached out to ICSA and was able to attend the Colorado workshop, where I met other survivors and learned about the key necessities for cult recovery, including boundaries, understanding trauma, understanding thought reform, and reintegration challenges. At the Colorado workshop, I was also referred to the books Trauma and Recovery by Judith Herman and Take Back Your Life by Madeline Tobias and Janja Lalich. I used these books as self-treatment plans to walk me through my own recovery process in the absence of meaningful and relevant support from my assigned psychiatrist. Contrary to what I learned was a common diagnosis post-cult experience, my psychiatrist intentionally did not diagnose me with PTSD. Her rationale for this was because she didn't want the stigma of that diagnosis to affect my ability to receive insurance in the future. At the time, I didn't understand the significance of getting a proper diagnosis to being able to access meaningful care and treatment. At the time, I thought she was doing me a favor, protecting me from the system. But it meant that I had to source needed resources myself because they weren't provided by my mental health practitioner. Along with using the books by Herman and Tobias and Lalich, I researched stress-related conditions and used those resources as well to help recover and build my own capacity. After a year and a half, the psychiatrist stopped seeing me and put me on a waiting list for psychotherapy. I couldn't abide waiting to continue my recovery, so I sought support from a private psychologist. He had his own experiences with the spiritual group, but failed to comprehend the harmful effect I experienced with mine. The fact that he could relate to some of the spiritual principles I was still loyal to helped create some sense of relatedness. Overall, the psychiatrist's therapeutic emphasis was grief and empowerment. She helped me stabilize, helped me stand up for myself at work where I was also being exploited. She did not address the concept of trauma and avoided escalating my diagnosis, potentially activating additional supports. She did not acknowledge the nature of the experience that brought me to her. In retrospect, she did treat me as having adjustment disorder. And with her help, I was able to stabilize and ground myself and get settled into new life circumstances with a new place to live and a new job before she cut me loose. What was not addressed were the deeper issues of the experience of coercive control, betrayal, exploitation, relational trauma, spiritual abuse, abandonment by my family, and the effects of the disillusionment on my worldview. In contrast, the psychologist's therapeutic emphasis included anger management, connection with emotions and feelings, increased body perception, stabilized worldview, stabilized spirituality, understanding the nature of experiences and relationships in childhood, and developing autonomy and agency. Not addressed by the psychologist, however, was that he never seemed to make the effort to learn about cults and their effects on survivors. He seemed to dismiss the relevance of the experience and conflate it into other issues. This felt discrediting, but I stuck with him because I had no hope that anyone else would be able to do a better job. In later sessions, he started focusing on a practice called logosynthesis, which was somewhat triggering as too similar to practices used in the cult. I had some success with accessing some previously unknown subconscious memories through this method, but I struggled to engage fully in the practice out of the fear of being manipulated as before. The fact that he even used this method with me was testament to his not really understanding the issues I was facing and his obliviousness to my terror of having it happen again. There was no way I could relinquish my control over my life ever again. No way I could submit to the authority of another human being after the experiences of exploitation that I had had. There were two serious gaps in the psychologist's support. Adverse childhood experiences research was not mentioned until 2014, although he had early on mentioned the influence of early life experiences in adult life experiences. After I had heard about ACEs and started researching them myself, I actually felt the greatest sense of validation and relief, not for my cult experience directly, but for the train wreck the first 20 years of my adult life ended up as. The second missed opportunity was the fact that I had known my psychologist for over 15 years when I found out he shared the same birth position in his family as me. It seems like a simple thing, but it felt important to me after I found out. He had overgeneralized his spiritual group experience to mine, and yet didn't where it came to something more relevant to our mutual early life development. Regarding self-disclosure, I know that self-disclosure is a controversial topic within the mental health field. I know that during training, we're all threatened with ethics violations when it comes to self-disclosure. The problem is, as mutual humans in a therapeutic relationship, sometimes a little self-disclosure creates connection, which deepens the potential effectiveness of the relationship as therapeutic between those two individual humans. Far too often, we treat patients as categories rather than as individuals with different experiences and treatment needs. The factor of self-disclosure is, I think, one of the most important in the therapeutic process. Of course, we don't self-disclose to get our clients to support us, but how much more validation, hope, connection, and relatedness do we inspire with our clients when we let them know? Me too. Regarding PTSD, it took me 15 more years to get the actual help I needed, which came in the form of a peer support group with veterans. They learned from me, I learned from them. For 2 years, we helped each other navigate the effects of our various traumas and gain traction in our lives. I will never know if an official diagnosis of PTSD would have benefited me at the beginning of my recovery. But even without the diagnosis, I was thankful I had learned about its possibility at the Colorado workshop and focused some of my independent research and healing on that recovery. I understand that I'm perhaps more resourceful than some others. Perhaps I'm more stubborn. Perhaps I'm more arrogant or self-assured. Perhaps I was just outraged and motivated by anger. Whatever the cause, when I realized the true nature of my cult experience, I took charge and accessed the supports and knowledge I needed to cleanse my psyche. Ultimately, I understand that that was my survival approach. I understood that since I didn't recognize the manipulation and exploitation, in order to protect myself from ever having that happen to me again, I had to understand what had happened to me and why, and develop the critical thinking lens to be able to protect myself in the future. I also understood the limitations of the psychiatrist and psychologist and used them the way they could be a benefit to me, and filled in the missing resources myself with substantial support from the ICSA community. Now on to becoming a mental health practitioner. After having accumulated an enormous cache of resources over 15 years and having experienced the process of reclaiming my own autonomy and agency, I was finally able to take on the role of mental health supporter for others. I had wanted to work in the mental health field since I was 18, but I was never privileged enough to be able to take that route. In hindsight, I realized I never would have been as effective if I hadn't had the life experiences I have had. I'm an experiential learner, not a theorist. I understand experiences better viscerally than cognitively. This can also be problematic, though. I haven't taken a traditional path to becoming a mental health counselor. Unlike many in the field, I don't have a hierarchy of degrees in a single field such as psychology or social work, which unfortunately diminishes my competency and qualifications in the eyes of many protectionists working in the field. But I do have 9 years of post-secondary education in the fields of early childhood education, Russian studies, linguistics, adult education, teaching English, and most recently, counseling. I also have an extensive lived experience background in business, along with being a survivor of adverse childhood experiences and multiple cults. Many of the challenges my clients bring to therapy are ones I relate to personally, which enables me to be compassionate and in many cases more insightful about the underlying factors the clients may be having difficulty surfacing on their own. My clients don't have to know the specifics of my experiences, but they do come to understand that I get them. And we know that being heard is one of the most important aspects of the therapeutic relationship. Once again, we come back to the point of the value of lived experience in the therapeutic relationship. I don't have to disclose the specifics of my experiences, but letting my clients know I've been there too establishes enormous credit for them. And I prove my credibility through the quality of the insights I reflect back to them. They know I'm real, not spouting off some textbook compilation of a researcher's data accumulated from people who actually had the experiences most learn from. Which brings me to the point of humility. With the current and exponentially increasing level of need for mental health services across humanity, hearing psychiatrists, psychologists, and social workers discredit the value of counselors, paraprofessionals, and even peers in the hierarchy of service providers is, to me, counterproductive. As long as we all understand our scope and work within it, we can collaborate to help more people more efficiently and therefore more effectively by utilizing all levels of mental health support providers at their levels of competency. After all, there is enough work for all of us, and the amount of accumulating data of iatrogenic harm from accredited mental health providers is exposing the unreliable nature of the sanctioned qualifications in the first place. Observing vitriolic therapist feuds on social media undermines perceptions of the profession in my own eyes and in the eyes of potential service users. It also brings me to my next point, which is that we each need to deal with our own issues so we can be healthy providers ourselves and not get drawn into feuds with others who have different areas of expertise that are valuable in the collective mix. Speaking of those different areas of expertise, cult survivors as mental health practitioners have extremely specialized knowledge to share with their colleagues. But when people are not willing to learn, nor willing to learn from people with different sources of education from them, our collective levels of competency are held back. One of my favorite sources of professional development are the mental health seminars offered by colleagues through ICSA, because most either have personal experience with cults or have worked with cult survivors for many years. We get the experiences that cults entail, and we can collaborate with each other and strengthen each other's and our collective competency. That's why I value the cult counselor peer support group that Olivia, Erin, Jen, and I established after our last ICSA conference. We've been getting together monthly to connect, share, support, and co-create. This presentation is a direct result of our collaboration. Erin and Olivia will add different points to their portions of the presentation. Jen will have prepared a handout that summarizes the main takeaways of our panel discussion. In the meantime, I'll end here and look forward to hearing from you and answering any questions you may have. Thank you for attending our session.
Hello, everyone. My name is Dr. Erin Falconer, and today I'm going to present a little bit about my experience both as a survivor as well as being in the mental health field, and any insights that I've gathered from having both of those experiences. So what can we contribute as both survivors as well as mental health professionals? Well, one of the things that comes to my mind is the fact that as both survivors and mental health professionals, we've really had a lived experience and understanding of a full spectrum of what coercive control looks like, both from the perspective of someone who's experienced the being victimized by the coercive environment, as well as the experience of navigating recovery after that experience, as well as the considerations that we've had to make during our mental health training and our work as a therapist or counselor or other mental health professional in this field. And in particular, we have that lived experience of the stigma that can happen with coercive control and the experience of coercive control and its impact on the mental health recovery. We also have a kind of expertise that when we go into the mental health profession, we can see the gaps in the understanding of other professionals who may not have had this exposure or experience. This is a little bit about my background. I was indoctrinated into a group in 2003. Prior to that, I, interestingly enough, was doing a master's graduate degree in neuroscience. So I was already thinking about the brain and mind. So when I went through this experience of indoctrination, as it was happening, I was really curious about the experience and thinking, wow, what's going on with my brain right now? And I left the group soon after being involved. So I didn't have a long experience within the cult, but on leaving, I had very severe, complex PTSD symptoms, and this experience of having been brainwashed that really was so potent and acute. And when I left, there was very little immediate help in my environment, and so I really had to seek it out. And during the first few years after leaving, I went to many different practitioners, really tried to get some understanding from a variety of different places. So for me, I decided, well, I want to study this more So I went back to graduate school to study psychology and neuroscience, and particularly look at PTSD, what it does to the brain, and also had an interest in hypnosis and neuroscience, as well as trauma recovery. And more recently, I've gone back to study specifically on the psychology of coercive control at the University of Salford, doing some postgraduate work looking at specifically that psychology. And then currently I'm training at the Institute for Contemporary Psychotherapy in New York, particularly in the trauma division, and have clients or patients in that at that institute, and finishing a degree at Columbia University to get licensed as a psychotherapist in New York. So for me, after leaving the group, my own personal experience was I would underline, a substantial lack of understanding from the doctors I saw, the psychologists I saw, the counselors, other therapists. I would describe it as another layer of gaslighting, already coming out of this experience and being confused, by the navigating of my cult experience, and then the post-cult identity, and then coming into back into the world of doctors and therapists that didn't understand and either didn't believe in the experience or weren't well versed enough to really hold space for that experience. So I was misdiagnosed by many doctors and by many therapists as having psychosis, anxiety. Most agreed that I had very complex type of PTSD. And that lack of mental health support after leaving was pretty profound for me. So I found the cult recovery, the awareness community like ICSA was very helpful, was extraordinarily helpful, actually. But there were some places within that experience that also signified like a lack of understanding of my own personal experience. I had such an acute PTSD after leaving that when I came actually to my first ICSA conference, ICSA conference in 2003, I went to the support group, which was really helpful for survivors, but was triggered acutely and was in a type of flashback while I was at the conference. And I had one particular cult expert ask whether, when I came up to them and started talking about my experience and started asking about, what do I do? What can I do for this state that I'm in, this mental health state? They were like, oh, I think you might have schizophrenia, which was like, on reflection, like absolutely terrifying for me. And really like did not acknowledge what it might look like to have to be in a severe triggered flashback as a cult survivor right after leaving. So there were definitely gaps in the understanding of the community, the cult and coercive control recovery and awareness community as well. So navigating that was a whole other journey for me. But what was helpful were the mental health practitioners who I saw that were knowledgeable enough about complex PTSD, who believed that I had complex PTSD and were able to give some tools for me to use for that, including somatic body work, EMDR, exposure-based trauma treatment. So all of that was helpful. And then having peer support, that was also helpful. A lot of it also was my own drive to heal. So there were definitely gaps in the support that I received. For me, reading and psychoeducation, like educating myself based on some fantastic books. But I was the one that was really seeking those education materials out and processing the experience through writing. And just the caveat for both of those was coming out of the group that I was involved with. I had such severe cognitive issues that I found it very difficult to read and very difficult to write. And the writing was very triggering for me, but I found them helpful at the same time. So it was kind of arduous work after leaving to really read and to write and to kind of get those areas of my brain working again. And then, like I said, healing through different trauma treatments was also really helpful for me, and connecting to other survivors and specifically those with cult recovery expertise, just having that, being believed and being able to talk through my own specific experience in the context of that understanding was really helpful. So when looking back and then looking, after that experience through my training as a neuroscientist and within trauma and, trauma treatment, and as a therapist, moving forward into as a therapist and specifically looking at how can I help people who have had these experiences or other types of complex trauma. I'm very aware of the need to really be sensitive to the specific course of control experience in patients. So, this is beyond treating a simple trauma, not that trauma is simple, but it's like this other layer that, I personally believe is there for certain people after they've been involved in these sort of intensely psychologically traumatic experiences. So particularly the specific cognitive impacts of this involvement and the bizarre belief systems that a therapist, I believe, should be considerate of, that this, these belief systems are not psychosis. This is something else. This is a result of the specific, mechanisms and machinations of the coercion within groups. And to an untrained therapist, it may be really, there might be an instinct to think that this is like some sort of pathology that like a psychosis. As well, the sensitivity to the idea that if you use as a therapist tools such as hypnosis, meditation, mindfulness, relaxation, that may be triggering to a person who's had an experience of being manipulated while meditating or being hypnotized or having a type of relaxation that made them more vulnerable to coercion. So you would get this sort of relaxation-based anxiety happening in these patients. And then unusual triggers, based on cult involvement, like certain words and phrases for me were really triggering, certain ways of being looked at, and colors were even like just very specific, unique triggers that may happen in other forms of trauma, but there may be a little bit more bizarre based on the person's experience in the coercive group, as well, of course, like authority dynamics within the therapeutic space. And also, I have more to learn about the diversity of experience within like the continuum of cultic or coercive experience is an important factor. Whether or not a person is a first or second generation survivor is important. So those considerations are very nuanced, and I hope that mental health practitioners in the mental health field, it educates itself more and more about the nuances of these different experiences and traumas to help be more helpful to survivors. So as a therapist who treats survivors, I believe it's very crucial to be educated on cults and coercive control. It's crucial to be educated on cults and coercive control as a therapist, period, because it's pervasive. Coercion is pervasive in our world. So I think understanding coercion and its dynamics and what it looks like and what the trauma can look like specifically is really important. And also being aware of any instincts that to invalidate the experience of the survivor and pathologize the survivor. The bizarre thinking may be a very, very rational type of thinking based on how the survivor was trained in the group. So it's important to have that sensitivity, I think, as a mental health professional. And also that, like I said, the sensitivity to the unique triggers like relaxation-based anxieties, really important and helpful to know about as a mental health professional. So these are some of the things that I'm taking away from my own practice going forward. But I'm very happy to learn more and to collaborate, and feel free to reach out to me. My email is here, my website is here, and I also look forward to answering any questions that you have. Thanks for your time today.
Hi, I'm Olivia Djouadi, and I'm one of the panel who's going to be talking on insights from survivors of mental health practitioners. So I'm Olivia Djouadi. I live in London in the UK, and I also work as a clinic at the Clinic of Dissociative Studies, and as a private practice clinician. I'm a UKCP accredited adult psychotherapist. I'm an ACTO supervisor. I'm an NCS counsellor, supervisor, and child therapist. And my web address is oliviadjouadi.online. So, as a clinician, the three areas I would like to talk about is the first steps in healing, the pros and cons, the training to be a psychotherapist, where I noticed that no cult or influential groups was taught and useful in progressing into the future. So the first steps I want to look at are what happened to me when I first had therapy in the UK. I had just come out of captivity, or of a captivity situation, but I was still being stalked from time to time by the person who did it. I had a lot of dissociation about it, so my memory was very patchy. So I was not very aware of what was happening because my world just seemed to be disappearing over and over again. So part of the issue was that I have a lot of medical needs, and I kept becoming sick in hospital all the time. Not as in thrown up, but I mean sick as in my levels kept going out of sync. I kept becoming very poorly, and because they couldn't deal with it through medical means, they thought that maybe it was a psychological situation. So they thought I must be depressed. So they sent me to a year-long psychotherapist who was in the NHS, and the rule was you must attend every week for your healing to be successful. So I started going, and I wasn't making a lot of sense at the beginning. I was still very afraid. I was still very traumatized, and I was also unaware of some of the parts I was traumatized about. So I was trying to explain some of the trauma, but because depression kept being looked at, it wasn't fitting me. I would probably say anxiety usually rises to the top, as well as dissociation. So the person kept trying to do therapy that didn't fit my needs, and I was then being a difficult client because I wasn't going along with suggestions or her ways she felt were helpful. So the person that had held me captive and was stalking me found me at the clinic and sat down with me in the waiting room. He asked me what I thought about my therapist, and I said I didn't like her, she doesn't get me. And he said, no problem, I can have her killed. and I became very frightened. And I was very frightened when I went into session, and the therapist said to me, well, it looks like you were in control of all of that, because when he said that he wanted to kill my therapist, I jumped up and was waving, no, 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 please don't, please don't. And that's what she saw. So she saw me as the aggressor of that situation. I kept saying that I was scared. I was trying to tell her I didn't know what to do. I was frightened. And towards the end, I said, please, please, can I leave by a side door? And she said, no, you go out the front door like everybody else. And I knew I would be in trouble when I left, and I got raped upon leaving. And I then went to the psychologist who first referred me and said, please, I can't go to therapy anymore. I don't like it. I can't deal with it. She didn't understand what had happened. So she said, oh, you're very fortunate to have NHS therapy. So you need to go back and continue every week. So I went back, but my brain had somehow pushed that rape and therapy time together. So every time I went to therapy, I thought I was being raped. And I became very frightened in therapy. This wasn't seen. And towards the end, I had a time when my daughter was poorly, and I had tried to cancel the appointment in the clinic, and she said no. So she told me to bring my 3-year-old with me, and it ended up with my daughter went and touched something quite colourful, and she flipped. The therapist, she screamed at me, being that I was a bad mother. She screamed at my daughter for touching things she shouldn't. She was only 3 though. And so my experience of therapy was devastating. My trauma wasn't looked at all in the whole year. I then learned I was a bad mother on top of it. And I thought, I'm never going to therapy again. So I went to someone who did massage therapy, a kind of body therapy. And she started working on me, and straight away she saw my trauma. She understood that my body was shaking because I was so scared. She understood that my breathing was messed up because I was so scared. And she did a lot of work with me. And she also took trauma classes. Even though she wasn't a psychotherapist, she found a way to attend trauma classes. So she was a godsend. But she did say, I really think you need to talk some of your experiences out. So I did get a therapist, and he was probably fine, but he wasn't the right fit for me. He talked about lots of things he'd learned. So he was always informing me about what this theorist said and what that psychologist said, and it all became very weird. And then at one stage, I think he got some advice from a supervisor that there should be distance between me and him, and he shoved me in the corner of the room, and we were in a really big room. So it was so weird. And he found it very strange that I kept talking about dissociative disorders. He didn't know why I was so obsessed with it. Because at this point, I felt that I must have that. Another clinician had suggested it might be that. So looking it up, I was like, well, that's me. So I was, quite a funny thing happened. Whenever he started talking about theories in my session, somebody in my head because I have parts, dissociative parts, started screaming page numbers, which I found funny, so I would laugh in the middle of serious therapy. So it became quite distracting, I think, for both my therapist and myself. He did try, though, so better than the last one. I then decided that I would go for someone who had more awareness of the body, because I knew that my body felt wrong. So I got what is called a Sharon therapist, which they had more focus on the body. And he was excellent. He understood a lot about trauma. He also did courses while he was with me. He kind of guided me to as far as I could go, but I still had some healing to go, because the person that is your clinician needs to be skilled enough in order to help the situations that the client holds. So he could help with traditional trauma that can be found in an abusive household, but not so much on the group stuff that I've been through or being held captive. But to be fair, he was a lot better than others I'd had. I was also training to become a psychotherapist. I was looking a lot into dissociation and trauma in my studies. Every single paper I did had some relation to trauma. Every single presentation I gave had to do with dissociation or trauma. So I was very focused on dissociation, what it is, what it looks like. And I think that's something that should be taught more in the training courses. And I think it also needs to be taught that sometimes therapy can be long-term work. I think there's a big focus on let's get this all sorted out very quickly. And that would be a miracle for me to get 6 weeks of therapy and be cured. But I think that's what clients are expecting, because they keep being told that you can be healed quickly. And I think that needs to stop. I think that, some of the progress for the future is to say that, if you have been through a lot, it may take longer to receive the healing that you need. I think that there should be maybe groups of trauma therapists connecting, so they can share the knowledge they know, not only about the specific trauma area that they work, but also about their own lived experiences. So I could tell you about the 2 cults that I went through, but if I heard from other clinicians that were also sharing their experiences, it means that we would all be learning. I think that peer supervision is something that should be looked at in the future. I also think that we need to look at other ways healing occurs. So at the moment, it's psychotherapy and counselling, and everyone looks that way. But what could alternative therapy do in the aid to healing? And what could things like retreats that have some beneficial healing for some people, is there something that we can take from there and add to our own practice? I think we need to talk more to survivors, and especially, survivors who are clinicians. I think we also need to connect a bit more. There are some major groups or cults that are worldwide. There are cults that are very similar to each other. And I think that sometimes there can be finger pointing about, oh, well, that's where cults are and they're not here. When actually, you don't know how close a cult may be to you. There may be someone on your street who at the moment is being influenced by a cult leader. You just don't know. And it's not until they escape that you might start to realize, oh, yeah, they look a bit off. I think that we also need to share more as well. I think that is happening in psychotherapy, where trauma experience and is being shared among clinicians. But I think that I don't think the idea that you need to have written a book to be believed should be part of one's knowledge base. I don't think people ask me, for instance, what book have I written? And it seems very strange to me that although I have a lot of experience in treating clients with dissociation and trauma, that I don't count unless I've read a book. That's very strange to me. I mean, I have given talks, I've spoken at international conferences, I have written a chapter in one book, but the fact that I haven't published a lot of books means that I'm not educated enough. And I think that needs to stop as well, because there's some people that don't have the academic accolades that marks them as more knowledgeable, but there are people that have had life experience that will be very good for the healing that we do with others. So I think that also mixed groups, I think, would be helpful as well. So there are some mixed groups like ICSA where you have both people that have survived and are now coming out of cult experiences, and also clinicians who work with people that have been through that. And it means that there can be some explanation shared. So it might be saying to people, psychotherapy can be really helpful, providing you find someone who understands this type of trauma. I think as a client, we may see somebody and expect them to know everything about trauma. And actually, it's not quite the case. One of the areas that I also work is with medical trauma. And that is very different from sibling rivalry trauma. So I think that we need to share more of the knowledge that we have. And I don't think we should be marked by, do we have a doctorate written? Do we have a PhD? Have we written books? Are we speaking at certain conferences? I think that there's all these markers, which means that those that have life experience don't get heard. And I think that needs to stop, because they do need to be heard, because it will progress where we go in the future about caring for these clients. So I think there is still some ways to go before, the ideal is found, but I think we're getting there, thankfully. I think that with the panel that is part of this group, we are very good at, um, talking with each other and sharing our own experiences. And it means that all of us in the group are learning much more about what other people have experienced. And it adds to how we can work with our own clients. We've got people from a couple of continents and people with some real, in-depth knowledge of certain areas of therapy and psychology and so forth, and those that have knowledge of the culture that they live in, because I think that sometimes is forgotten about. Many of the forefathers of psychology tend to be white male clinicians. Freud, Jung, Charcot, all male, all white. But that doesn't really fit when you have someone who doesn't fit that very narrow area. I mean, it has improved over the years, so there's more women speaking, there's more people from other cultures speaking, but I think that there's still not enough being shared between various groups. So are those from psychology talking to those who are working in religion? Are they working with those that are from a different continent? We're always learning. That's what we are as humans. And by the learning we do, we can be very beneficial for the clients that we're seeing. And the reason I included a picture of the world as part of my presentation is that trauma isn't in isolation. Trauma is worldwide. Whether you're from a Western country or not, that doesn't mean that you shouldn't get the healing that you deserve after suffering some sometimes life-threatening harm. But we're getting there. We are getting there. And if you haven't been to therapy before, that's okay. If you do feel like therapy, then there are directories in the countries that you're in. And there's directories specifically about trauma therapy. And you may find support by a friend or a relative that might have said, oh, I went to therapy and it was really helpful, or I went on a retreat and it was really helpful, or I spoke to somebody in a certain profession and they were really helpful. So sometimes people run into therapy by accident almost. So, we learn from each other, and we also learn from our clients the strength each of them hold, even when they're, they feel at their worst. They're amazing people that are carrying so much, and somehow they've made it to your therapy room. So we just treat them with respect and hear what they say and believe what they say. some stuff may sound really crazy, but it's not. These awful things do really happen. And I think that's important to keep in mind.